Hi, everybody. And it is Thursday evening. We are live. It is our live Monica Makes It Happen Facebook show. And I should say Dr. Keisha Gaither makes it happen because she has been a regular on our show. We're so lucky to have her. She actually just stopped seeing her patients for just a few minutes to talk to us live and answer your questions if you're expecting or if you want to be expecting, some new moms or some new soon-to-be moms. This show is for you. Make sure to share and like it and to ask a question right now. We have a doctor live from Lincoln Hospital. The Bronx is in the house. Thank you, Miss Dr. Gaither, for joining us with New York City Health and Hospitals. We love Lincoln Hospital. She's a double board certified physician in OBGYN, with a specialization again in maternal fetal medicine, which is exactly what we need right now. Because if you are trying to have a baby, if that is your plan, and you're probably very nervous about everything and wanting all of these answers, so many questions. And luckily, one of my colleagues, Rebecca Solomon, on September 28th, filed this report with one person's story. Listen to her.
At 12 weeks pregnant, Anjali Bharati's fears became a reality when she tested positive for COVID-19.
It was the sickest I'd ever been in my life, and I was terrified.
The frontline worker's health was already at risk as an emergency room doctor at Lennox Health Greenwich Village. Through compromised oxygen levels and high fevers, Bharati slowly recovered and waited until a vaccine was available.
I was waiting for this vaccine because I thought, gosh, I would get it. I was like the first in line and waiting around for it. I didn't want to risk spreading this virus that we're all exposed to any further along.
She wanted to keep her loved ones safe, including her unvaccinated firstborn toddler and now her 5-month-old Rye. According to a new study released last week by researchers at NYU Langone, baby Rye is also protected against COVID-19 because Bharati received the vaccine when she was still pregnant with him.
The antibodies cross the placenta and they're passed on, through the blood to the infants.
Dr. Jennifer Leiter is the senior author of the study. Her team of researchers looked at 36 newborns whose mothers received either the Pfizer or Moderna vaccine during pregnancy. Dr. Leiter says 100% of these infants had protected antibodies at birth, proving their scientific power to protect 2 lives at once.
This is now a bonus finding to realize that antibody is transferred to the baby. So when women get vaccinated during pregnancy, they're protecting their baby from COVID.
Dr. Leiter says pregnant women who contract COVID are at an increased risk of preterm delivery and intubation. That's why moms like Bharati didn't think twice about the vaccine, and she's thankful for the new research, which gives her peace of mind her baby is also safe.
If the way that you can give them a chance to fight off this virus is by getting vaccinated yourself and passing it on to your babies, that's the best way.
Additional research is needed to determine how effective the infant antibodies are and how long protection will last. To read the entire study, head on over to our website, pix11.com. I'm Rebecca Solomon. Back to you.
Oh, Rebecca, what a great job and what a great report. And so many people are talking about this. Dr. Gaither, Dr. Keisha, I like to call her because she's been on our show so much. Thank you for joining us. We know you're a busy woman right now. You saw a lot of patients today. And I just want to share with you that Ada Wong is watching. And thank you, Ellen, Amanda, my producer. I have 2 fabulous producers on standby, taking your questions, making sure that we get them to Dr. Keisha right now. She says, I'm pregnant. I'm fully vaccinated and we're okay. Isn't that good to hear? And Keisha and Felicia, it says, Monica, my niece got vaccinated and she is now 2 months pregnant. Don't we love to hear that, doctor?
Wonderful. Well, thank you so much for having me on again. And yes, it is wonderful that these women have gotten vaccinated because they know that, antibodies are being produced in their body, going through the placenta to help protect their babies once they're born.
Love it. And Jay Lee is saying, honestly, I took the vaccine at 30 weeks pregnant because New York State mandated me to get it or I could not work. So again, some people are saying it's mandated. We got to do it. Is it safe? Tell me, is it safe?
Yes, I believe that it is safe. Certainly, pregnancy is a condition of decreased immunity. I think Many people don't know that. Once you become pregnant, your growing fetus is seen by the body as foreign. So the body is very smart. It diminishes your immunologic function such that your baby can grow and thrive. And with that being said, with your immunity being decreased, you're at increased risk for developing infections like COVID. The other thing when you're pregnant, your uterus is growing, and as it's growing, it's decreasing your lung function because it's impinging upon your lungs' ability to expand. And we all know that COVID likes lungs. So that's another thing that I think people need to know.
Yeah. And
One
then,
that, okay, go
can
ahead.
you talk about side effects? I mean, are there side effects if you do take it?
For some people, yes, there are side effects. Certainly, you might have pain at the injection site. You might develop a low-grade fever. You might have muscle aches and fatigue, but they generally last maybe 48 hours, and then you're pretty much good to go.
Now, if you take the vaccine, does it protect your baby too?
As you have seen, there is research out there which shows that antibodies are passed through the placenta, and babies once born have those antibodies which, help protect them from getting the disease.
That's such good information and good to hear. Um,
Yes.
you're hearing from moms every single day. What are some of the common questions that they're asking?
Well, they ask, is it safe? Um, will I be safe if I don't get it? What could happen if I don't get it? What could happen if I do get it? Those are the types of questions that I hear regularly.
And now, we did all these beautiful stories about the New Year's Eve babies, the first babies of the year, and we saw the protocols change so very much during the pandemic. What are the delivery room protocols now, doctor?
Well, now at least one person can go into the delivery room. Certainly they have to have their PPE on. And on the postpartum unit, one person can come. Once upon a time, in the early stages of the pandemic, as we all know, nobody was allowed anywhere. So that has relaxed a bit.
Now, does everyone have to be vaccinated in that room? Does everyone have to be vaccinated?
No, they have not mandated that as of yet.
And what about masks? Does everyone have to wear masks?
You have to wear your PPE. Absolutely. You have to be gowned and masked up. Yes.
Okay. And then, the CDC issued this alert urging pregnant women, trying to get pregnant to get vaccinated. What do you think about that? I mean, if you're trying to have a baby, is it safe?
I think that it is. I really do think that it is. As I've said, the body's immunologic function decreases once you become pregnant. And so you can think of yourself as having a little bullseye on your back if you don't have the vaccination. I mean, you need to have something that is going to help you fight this virus.
Now, we talked to you before about ways of boosting that immune system. And like you said, it was so disturbing what you said about when you're pregnant, those defenses are kind of down because, again, you have this foreign object, your baby growing. So how do we boost our immune system during that very important time?
Well, I'm a big proponent of vitamin D. There has been a lot of research out since COVID has made its presence concerning how vitamin D boosts the immune system. I think that it is very much important to know that, particularly for women of color. Vitamin D is a vitamin that is produced by the skin in conjunction with sunlight. However, if you are melanated, your vitamin D production is automatically diminished. So for women of color, I think it's very important, particularly when you're pregnant, and certainly if you have comorbid conditions like diabetes, to have your vitamin D level checked and to be supplemented. Vitamin D has a number of great functions. It boosts your immunity. It decreases your risk of preterm labor. It certainly helps in bone formation, not only for you, but for your developing baby. It's good for your cardiovascular system, particularly for those moms that have high blood pressure and heart disease. And, again, it boosts immune function.
Yeah, and there's so many questions coming in right now. And Nadia Blake, thank you for watching. Pregnant women, she says, should be exempt from taking the vaccine because while you want to protect your unborn, but you don't know the long-term issues of this. Dr. Gaither, we are hearing this a lot. What would you say to Nadia?
Well, think of it this way. Which would you rather have? Would you rather have something that's going to protect you, or would you rather, be exposed to COVID and deal with the untoward consequences that it can bring?
A hypothetical question that everybody wants their baby and themselves to be so healthy during that key time. Now, when you do talk to moms, are there any other questions that come up that you want to share with us? Maybe some common questions that are asked, other than that it's safe. Obviously, that's the biggest one.
Absolutely. There's a certain substrata of patients that I think it's really important to get the message across to get the COVID vaccine. Certainly pregnant women who have comorbid conditions, particularly diabetes. The deaths that I did see during this point in time have all been in mothers who are poorly controlled diabetics. So COVID really likes diabetics. So I think that particular I can't speak tonight, sub-segment of patients, it's really important to get the vaccine. Women who are obese, certainly women who have cardiovascular disease, all of these patients who are sub-segments of high-risk patients really need to consider very strongly getting the vaccine.
Seen expectant moms with COVID. You have seen them?
Oh, absolutely.
And
Absolutely.
and
All the time.
how do they do? Is it since your immune system is down, you would say it's quite a struggle.
Well, in the early phase of the infection, when New York first got hit with it, we saw a lot of really bad outcomes. Mommies in the ICU, mothers with respiratory compromise. We saw deaths. We saw quite a few deaths. Fast forward, what we see now is not so much ICU admissions, but a lot of decreased respiratory function. And one thing that I am seeing a lot of, there is something known as pericardial effusion, and a pericardial effusion is fluid around the heart. I'm seeing that a lot in pregnant women and also in their babies.
And Jay Lee is chiming in once again. Hi, Jay Lee. Thanks for watching us this evening. What is the protocol for the women in labor herself? What is the protocol?
She has to have a mask on. She definitely has to have a mask on, and everybody in the room has to be, in their full PPE garb, including her partner or whoever she chooses to have in the room.
That was such a good question. And again, things have changed. And I tell you, people are so many times, like a lot of our viewers, we are still in a pandemic. We want to remind people in the last 30 seconds that we are still very much battling COVID, and that it's so important to not let our defenses down. Is that right, doctor?
It hasn't gone.
And especially with soon to be moms, is there a parting message that you can give our audience tonight, the last 30 seconds?
Get your vitamin D. Get your vitamin D. And certainly if you have any comorbid conditions like diabetes, hypertension, and you think you're pregnant, go immediately to see your doctor to get enrolled in prenatal care, and make sure you get your vitamin D.
Oh my God, such good. We're all going out to get our vitamin D this evening. We just love you, Dr. Keisha. We just adore you. Will you come back and see us?
Absolutely.
All right,
absolutely.
you have to go back. You have to
go
back to work. She's so busy. You have to go back to work, and we just adore you. And thank you, everybody, for watching us. Always, Thursday nights around 6:45, we are live, and I'm so happy to be back in the building, back in the office here. And don't forget to take necessary precautions, get vaccinated, get your vitamin D, and always watch us at 5, 4, 5, 6, and 10, and our morning show too. We're making it happen.